Good morning and a very warm welcome to all dignitaries, guest faculty, health professionals who have logged in through Zoom and who are viewing our YouTube link too. So welcome to Quest for Excellence, the first day observance. Quest for Excellence, or Q4E, as it is very popularly called, is a flagship venture welfare, Government of Kerala, aimed at harnessing skills of students and professionals in the health sector. Better health. And what better way than to launch this initiative today on April 7, 2021, as we celebrate World Health, building a fairer, healthier world. So with these few words of introduction to Q4E, I invite Dr. Ramla BV, Director of Medical Education, Kerala State, for the welcome address. Over to you, Ramla, madam.
Thank you. Is it audible?
Hello.
Can you hear me?
Yes, ma'am, we can hear you.
Good morning, sir. Valiathan, sir.
Yes, ma'am. Yes, ma'am.
Respected Valiathan, sir. Respected Rajan, sir. My dear colleagues, dear friends, and my students. Extremely happy to stand before you in this occasion of World Health Day, which is celebrated on every year on the 7th of April. Today we are having one of our famous guests with us, and the eminent teacher, eminent scientist, eminent teacher with us. That is Dr. Valiathan sir. Valiathan sir has been the founder, director of our famous Sritra Institute of Medical Science, and he has been the former president of Indian National Science Academy, and also he is one of the famous cardiac surgeons as well. See, I had an occasion when I was working in the Medical College Kottayam to hear a long talk regarding the legacy of our medicine practice, systems of medicine which was practiced in India. So excellent talk. I still remember the talk how he sir delivered that speech. Thank you for that, sir. Today my role is to say a few words of welcome to our dignitaries. First of all, I welcome our teacher and our guide, that is Patna Bhushan, Dr. M.S. Valiathan sir, to this occasion for his kind willingness to address the occasion. Then comes our lovable Rajan sir, our Principal Secretary of Health and Family Welfare. Actually, this program came from his brain. This is the brainchild of our secretary. I also welcome Rajan sir to this function. Dr. Sarita madam, she is the Director of Health Services. She is the pillar against all the activities that is happening in the health sector. I welcome you, madam, also. And also I welcome all the other, my dear colleagues, my students, and all the health functionaries who are both working in medical education sector as well as health services for this function. I wish all the very best for the conference, and once again, I welcome you all. Thank you, sir.
Thank you, ma'am, for the very warm welcome. Q4E initiative is the brainchild of Dr. Rajan and Kobragede IAS, our respected Principal Secretary, Department of Health and Family Welfare, Government of Kerala. So on this occasion, on the launch of this first state-level meet of Q4E, I invite Dr. Rajan and Kobragede sir to address the delegates to flag off this initiative and set the ship sailing. Over to you, sir.
Thank you, Doctor. At the outset, let me tell you that it is not only one man's initiative. It is a collective initiative, and that is what we are seeing in front of us. So today's chief guest, Honorable Dr. M.S. Valiathan sir, my colleague Dr. Ratan, Dr. Ramla BV, Dr. Sarita, all principals of medical colleges, faculties, not only of the government colleges, but also of the private colleges, our district medical officers and all our program officers, and my dear students and field foot soldiers. On this auspicious day, in fact, let me at the outset wish you all very healthy and hearty life. When we were approaching World Health Day, in fact, a thought came in our mind. Then what is the way, in fact, we should go ahead in this on this day? So today we are honored and privileged to have Sir in midst of us. And to briefly tell you, in fact, Sir is a revered figure. And when I was also studying in the college, when I came across and read what a profound impact has been created by Sri Chitra in reducing the cost of the cardiac care, not only within the state, in the country, but throughout the world. On that day, in fact, I was wondering whether I will get an opportunity to meet Sir and also visit the institution. And therefore, the thought came when we, in the organizing committee, we were discussing, in fact, there will not be any better person than Sir to guide all of us what is the way ahead for Kerala health and also health sector in particular. So we indeed are very happy to have you, Sir, with us. 2 points regarding Quest for Excellence. The objective of Quest for Excellence is to inculcate spirit of inquiry and also evidence-based intervention. Now, with these two objectives, in fact, we would try to build feedback loop, not only at the policy level or also at the implementation level, but at each and every level at a cutting edge, right at the grassroots level, onwards up to the top level. We are looking forward to undergraduate, postgraduate, and also faculties, and not only them, but also our field functionaries, our program officers, our foot soldiers who have been working untiringly throughout this period. And therefore, whatever outcome indicators or impact indicators, what we are seeing is because of their Herculean task. And what we thought is that they should have a forum which will give opportunity to showcase what they feel is a little intervention, but which is a very big, because all these little interventions become a part of the whole. So with these few words, in fact, I will not stand between you and Sir, and I would respectfully request Sir to deliver his talk to all of us. Thank you very much.
Thank you, Dr. Rajan, Kobragade, Principal Health Secretary, Government of Kerala, Director of Medical Education, Director of Health Services, principals of medical colleges in Kerala, members of the faculty, and the entire healthcare community who have assembled here today for the Zoom meeting on World Health Day. I would like to extend my greetings to you from Manipal, where I'm located. And I found in this literature that you have given a fairer and healthier world and quest for excellence. These both mentioned, and these are perhaps universal aspirations. Everywhere there is a utopia. We have our own Ramarajya. We want a fairer, kinder, greener, happier country. That is a kind of dream which inspires all countries, all communities. Now, the path to this target varies depending on the country, depending on the community. For example, if you take various professions, legal profession or medical profession, engineering profession, various professions, they all have their own paths towards excellence, their own paths towards what they consider success. So these will vary. And if you take our own in the area of medicine and healthcare professions, we have the first service in our own field, acquisition of knowledge, and being a good citizen. These are the three objectives in our training, medical training, any healthcare professional. We need to be good citizens, we need to have knowledge, and we need to be able to do service to the community. That really sums up regardless of the profession. But the problem is when it comes to knowledge, if you look at our own medical and healthcare area, there is a problem in this in India. Because the medical education as we know it came to India, the British introduced it in the 19th century. 1830 or around that time in Calcutta, the first medical college came. So it has been here for a long time, some 250 years. But in this area, when it comes to knowledge, we are able to get that, we are able to practice this very well. Indian doctors are highly respected everywhere, including foreign countries. We practice it well. But when it comes to creating knowledge, there is a problem in India. That is because in these 250 odd years since Western medicine came to India, there is not a single disease for which the cause was discovered in this country. When it was discovered, like Leishman-Donovan bodies, that Donovan was an Irishman working in Chennai. The transmission, vector transmission of malaria, another great discovery made in India. But it was made by Ronald Ross, who was not an Indian. So no cause of a disease was discovered by an Indian. Unlike in Brazil, Chagas disease. Chagas was a Brazilian. We don't have a single disease for which a cause was found. There is no single diagnostic test like CT scan or any of these new imaging technologies. There is not a single one that we have discovered. There is no drug that was discovered in India which is used all over the world. I am using a global standard, not used in a particular district or a particular state. Something which is discovered in India, which is used all over the world, like the Raman effect, which Sir C.V. Raman discovered Raman effect. And that Raman spectroscopy is done all over the world. I want that kind of a discovery in medicine. So there is no diagnostic technology that we have made. There is no contribution of that kind. Is there a surgical operation which was invented here, which is used all over the world? Again, the answer is no, we don't have. Now, this is with the result, this time has gone on like this for hundreds of years now. So in the system of our medical education, somehow the creation of knowledge is not taking place. There is something problem. There is a problem there. And the cause of this, when you look at it, the creation of knowledge comes from discoveries. Now, these discoveries, they require imaginative thinking, innovative thinking. That comes from an inquiring mind. Now, this is the root cause. In our educational system, we are taught to practice various techniques, drug administration, etc. We practice it very well. That is very well. I think it is excellent. But the problem when you don't discover any of these, it has become very acute today because World Trade Organization treats knowledge as a commodity. Just like a furniture or a car, you've got to pay for it. So today, the modern there is some noise. Now, therefore, with the result, when we don't create knowledge, we are simply buying all this from abroad. It has reached a stage we cannot afford it anymore. It was a report published by the Confederation of Indian Industry. There is some disturbance.
Dr. Ramla Devi, I think your mic is on. Vinod, as a host, you put off everybody's mic off.
So therefore,
Vinod, you have put it off Sir's mic also. Sir, you are not audible. Sir, I'll ask the host. Vinod.
Sir, Doctor, only you can unmute yourself. I have requested you to unmute.
Oh, I'm unmuted now. Can you hear me?
Sir, you are audible now, sir. Sorry for this goof up, sir. Sorry.
Therefore, what I was trying to say, the kind of knowledge that we receive, it is good for practice, but it doesn't serve this purpose of creating knowledge. If you don't create knowledge, in other words, when we import knowledge from abroad, suppose a CT scan, we are going to import. It is not really the hardware that we are paying for. What we are paying for is the knowledge which created that. That is what we are paying for. So therefore, when we don't have any knowledge to contribute in that manner, we have to pay in cash. This we are unable to do. In this report I was referring to with CII, which came, I think, 2 or 3 years ago, they have said that all these high technologies, instruments that we use, devices we use, in whether it is instrumentation, whether it is medical devices, in all these areas, 70% we continue to import at very high cost. And that time the import was 17,000 crores a year we were paying. And what is more distressing, this is accessible to only perhaps 20% of the Indian population. So the greater the cost, less the affordability, less the accessibility. So that defeats the very purpose of healthcare. We cannot have a fairer or healthier India if this gap keeps on growing. Now, if you want to develop this kind of technology of instrumentation or devices or vaccines or anything, then we need to have innovative thinking. And innovative thinking means an inquiring mind. This is what is not being encouraged in our system. And I can only give examples. I'm not a psychologist, but I can give you examples. When I was a medical student in Trivandrum, I belonged to the first batch of the Trivandrum Medical College. So 1953, we had started our pathology course. Pathology, as you know, is the foundation of medicine. And our professor was a very distinguished teacher. He had just come back from England, and he was teaching us a subject called inflammation, which is the very basic subject in pathology. One day in the class, he asked, what is the reaction of pus? So inflammation, if it is not controlled, it leads to the formation of pus. And this was common in those days. We didn't have antibiotic that freely available. So we used to have lots of patients with suppuration in the hospital. So he asked, what is the reaction? So my colleagues, they would say it's acid or alkaline or neutral. Nobody actually knew the answer to that. He listened very patiently. At the end of that, he said, I have listened to all of you. You have given me all these answers. And I know what you will do this evening. You will go to the library, look at all the books, references, and try to find an answer. I want to tell you that there is a better way to find the answer. I suggest tomorrow when you go to the hospital, you take litmus paper with you. Everybody knows litmus paper, red, blue. You take it with you and you go to the patients and test it directly, the reaction of the pus. It's painless, they will not object. And you will find whether it is alkaline or is it acid or there is no reaction. That also is possible, indeterminate. Then you look at the culture report of that patient. You may find what bacterium is growing there. You may find a correlation between that particular bacterium and the reaction. You may find sometimes there is no correlation. So you will find out soon there is no yes or no to this question. It depends on many factors. So that way you get a better understanding of pus, inflammation, and so on. That is the way to learn. Now, this is a very profound way of teaching because we are using our mind. That is the point, an inquiring mind. Not just go to the library. Suppose it is given acid or alkaline. That is also learning, but that is not an inquiring mind. Now, this is the foundation of all this innovative thinking. So that, I think, is a very important thing to remember. In Western countries, they do it much better than us. And I want to give you a series of examples, not to talk in philosophical terms. Actually, how did these great discoveries, which have come into our practice today, transforming the practice of medicine? Some of these I want to mention as examples of an inquiring mind. How does it work in Western countries? I'll be quoting only examples from the West because I don't have any Indian examples to quote. That is the fact. So here I would like to give first example that is from the 18th century. Edward Jenner, many of you have heard about him. Edward Jenner was a doctor who passed his MBBS from London. Then he moved to a place called Gloucestershire, which was the backyard of England in those days, to do practice. When he started practicing, this 18th century, smallpox was very common in Britain. So in Gloucestershire, there were a lot of people dying of smallpox. Large number of deaths, 1,000 deaths in 2 weeks, not uncommon. But the doctors at that time, they were prescribing fever mixture, various types of ointments to be applied on the skin. All these kind of prescriptions were being given. Mortality went on uncontrolled. But Jenner found surprisingly, milkmaids in this place, they used to distribute milk to families, selling. They were not afraid of this. They were going around from house to house. So he asked them, how come you're not scared of, there is a smallpox case there in that house. They said, no, we are not scared because we get this cowpox. When we milk cows, we get this on our hand. And so we don't get the smallpox. This surprised him. So when he asked his medical colleagues, they said, oh, these are ignorant women. They don't know anything. We don't listen to them. That was the response. But Jenner, he was inquiring. So he wrote a letter to his teacher, John Hunter, very great surgeon, the founder of scientific surgery, some call him. He was in London, so he wrote to him, his teacher, sir, this is what I'm finding here. It's a big surprise to me. How do you explain this? So John Hunter's famous reply came, my dear Jenner, why think? Why not experiment? This was the reply. That is where vaccination started. Actually thinking about it, an observation which everybody else dismissed as irrational, coming from illiterate women. So no doctor would listen to them. But here is a man who listened to it, observation, and he started testing. And that is how it's completely transformed the practice of medicine. This is an example of an inquiring mind. Another example I take from, again, simple examples, 18th century, 100 years later. Cholera was common in Britain in those days. And in London, there was a cholera epidemic. Lots of people died. And there was one area in central London, it was called a Broad Street. There was a street and there was a hand pump located there. Where all the local people will go there and use this hand pump to collect like we do in our cities even today. So that Broad Street area, there were 550 deaths. Everybody was upset. Nobody knew to handle this. And in those days, the theory, medical theory was there is something called miasma. That is some kind of a poisonous gas, invisible, floating in the air, and breathing that is producing this disease. That was the belief, miasma. But this John Snow, a practicing doctor, he was not a professor or anything, he was just a general practitioner. He found this very strange. So he had a notebook, he drew a diagram of this Broad Street, surrounding streets, and putting a dot every time there is a cholera case, he would put a dot there. And finally, at the end of this, a couple of weeks, he had a map with this locality full of these dots of mortality, of cholera. So he went to the district, nobody would pay attention to him. So he went to that district council people with this map, and he showed them, this is not miasma. I have mapped this, and this all around this Broad Street pump, that is where all these deaths are taking place. They are all taking water from this pump. So that is contaminated. There is something in it. Cholera vibrio, nobody actually knew the germ theory at that time. So he could convince this council that there is something in this. Many people didn't believe him, but that council somehow had the wisdom. So they came and removed that handle from the pump. And within a few days, cholera disappeared from there. Now that became a landmark in epidemiology. we understood long before cholera vibrio was discovered by Robert Koch. That was the cause. Again, you find that kind of inquiring mind. That's what leads to discoveries, innovative thinking. And then you take 20th century, of course. The best known example is Alexander Fleming, penicillin, and I had the good fortune to listen to him in Trivandrum Medical College. He came in 1951 or 52. He gave us 2 lectures in Trivandrum. And Alexander Fleming was a microbiologist working in London. He used to work on Staphylococcus, the commonest cause of infections in those days. And he would have a number of petri dishes growing Staphylococci. And one day he had gone on vacation. When he came back after 3 or 4 days, he found the number of these petri dishes, the staphylococcal cultures, they were all blotted out, destroyed by fungus growing there. So normally what happens is you throw it away. That's what everybody would do. You have to start again. But he noticed that this fungus, how come this fungus can destroy staph colonies on the petri dish? Maybe it can destroy it in the human body also, infections. That is where the thought came. It's a long story, later on Florey, chain, etc. It's not easy from a fungus culture to make penicillin. That requires a lot of chemistry, a lot of research. But this idea came from Fleming's observation and this kind of thinking. And again, you find this inquiring mind. That is, so you find that this inquiring mind, that is something which we are lacking. We need to do that. How to introduce it is difficult to tell. But it is not always that these great discoveries are made by great scientists. There are simpler things can be done, extremely useful. I want to give another example. Very recently, just a few months ago, Royal College of Physicians of London, they had carried out a study, commissioned a study. In Britain, every year, some 60,000 falls. They have got falls registry. I did not understand what is falls registry. I had to read to understand that. Falls registry, in Britain, there are 60,000 patients who fall down in hospitals, sometimes at home. So these falls are registered, and this is extremely dangerous in old people. Their life expectancy is very long, much longer than India. So falls, old people tend to fall. And when they get a fracture, often it leads, they have become bedridden. Sometimes mortality is there. Operations is an extremely dangerous thing, a fall in old people. So they have a register with a questionnaire, and every hospital or a house, wherever there is an old person who falls down, these have to be filled. And they're very meticulous in this. Whether a hospital or a home, they fill up all these carefully. The kind of the room, how did it happen, when did this happen, what was the light, all those are there. And this Royal College of Surgeons, they have a committee which is doing this. They look at these questionnaires, they analyze it, and ultimately they find certain common features. The place where they are, it is not well lit. Or new arrangement of furniture, they have all been rearranged suddenly. Fall has, because they are used to certain way of moving around in the house, that is disturbed and they fall down. So like that, they find out all this. This committee has to work very hard to do this analysis. A cause and effect relationship has to be suggested by this. And ultimately, they prepare guidelines for these. And these guidelines are approved by another committee. That is distributed all over for a journal, comes in the British Medical Journal, distributed all over. So if you can bring down the number of falls from 60,000 a year, if you can bring it down to 30,000, that's a very big gain, simple research. There is no need for expensive equipment here. So that again is you are using an inquiring mind. Now this is something which we need to cultivate. Medical teachers have a very great responsibility in this. and young students also, if you want to make the medicine much more interesting by doing this kind of work, apart from teaching the practice of medicine, which is basically what we do, but it becomes much more interesting if you are able to contribute this kind of knowledge. You're not helping only an individual patient, you are helping thousands of others. So I think that I hope we will on this World Health Day, something about an inquiring mind, how to instill this, or I cannot say instill, how to cultivate it. I would like to stop at this, and any questions you would like to have this or related subjects, I'll be happy to handle them. Thank you.
Thank you, sir, for that very inspiring talk. It is indeed our privilege to have the honor of presence and your immense knowledge and experience today. And sir is a recipient of many awards, many fellowships from prestigious institutes world over. Having sir with us today. So we have some questions come up in the chat box. So I to Dr. Mariam, who is a senior resident in the Department of Community Medicine at GMC Trivandrum. She will be facilitating the discussion. So over to you, Dr. Mariam. Dr. Mariam, are you there?
Yes, madam. Hope I'm audible to all.
Yes, yes, we can hear you.
Thank you, madam. Dear Valyathan sir, it is indeed a privilege to have you with us. Thank you for your wonderful message to our youngsters and all our health fraternity. Sir, we have some questions in the chat box for you. Sir, there is a question which says, is it possible to train the creation of an inquiring mind? So from your message, what we heard is that in the West, there is a spirit of inquiry, which seems to be somewhat lacking in our setting. So it would be a fallacy if we tend to think or believe that our brains are less creative than the Western brain. It would be a fallacy to think like that. So what is happening to our spirit of inquiry? Is there something which we are doing wrong or something which we are not doing right?
No, that's why I gave this example in our own pathology class. I gave a practical example. If you want to look at the pus and its reaction, usually what we do is we go to the library, we look at it, and that's the end of it. But that is not what we call inquiring mind. This is why I gave that example. Dr. Thangavelu, a wonderful teacher, he told us this is what he would do here, but that's not enough. The better way to do is to go do it yourself. You apply your mind, use your mind. This can be done everywhere. For example, so many people are falling, hip fracture, they lead to a hip replacement, hospitalization. All these are going on. So many falls are taking place. In Kerala also. We have also our life expectancy is about 70 now. We have plenty of hip injuries. But are we doing a study like this? Very simple. It is only collection of data and analysis, and then come up with guidelines, how we can prevent it. It can be done. Now that is an inquiring mind. We never do that. So there is our whole approach to the treatment is not enough. We have to study and come up with better ways of practicing medicine. That we are not doing. This is a problem with us. It is not that Western people are better. I'm not saying that. They have trained themselves better. We are not doing that. There is a problem here. I'm not very sure. I'm not a traditional medical teacher in that sense, where we teach. Because when you become a super specialist, you don't really take classes and so on. We don't have that kind of contact with young medical students. But what Dr. Thangavelu said, that's a classic example where we encourage inquiry, questioning, and understanding. That kind of understanding is necessary if we want to eventually to make a new diagnostic test, you want to make a diagnostic instrument, you want to design, all those will come from this only, from an inquiring mind. It is the lack of it for 250 years. We end up importing 17,000 crores worth of equipment and technologies every year, which we can ill afford. So that I believe that if 10% of our, we have 60,000 medical students, I believe we are admitting every year. And these are obviously bright youngsters coming through entrance examination, tough examination. So they're very bright people. So if 10% of them, they can be attracted to using their mind, inquiring mind, then I think there will be a transformation in our technology development in one generation. I'm sure it will happen.
Thank you, sir. What sir is saying that our approach to research should be more refined in the sense that we should apply our brains to problem solving and apply our research skills to problem solving rather than simply aim for analyzing data and simply publishing the paper. We should aim for something more than that, right, sir? Okay, sir, so we have a few more questions. So I request everyone to please unmute yourself other than Valyathan, sir.
They should mute themselves.
Yes, sorry, mute themselves. Yes,
Yeah.
please mute yourselves, everybody.
I spoke, I did not speak for too long because I want more questions. I want more
Yes,
to
sir.
hear from you. That's what I'd like to do.
Indeed,
More
sir.
speaking.
Many questions are coming up. So, one more question. It is indeed a great honor listening to you, sir. You have been the director of Sri Chitra and the Vice Chancellor of Manipal University. What, in your opinion, is the major bottleneck preventing healthcare institutions in Kerala from growing into centers of excellence like Sri Chitra?
Centers of excellence, if you mean by that, becoming like All India Institute, that's what everybody says. Now, All India Institute, I was myself, I conducted an inquiry on All India Institute, on its performance for 50 years. I know the institute very well. Now that scale, if that is your center of excellence, then there will be very, very few in India. Because I remember I conducted the inquiry in 2003, I think. At that time, they had, they take only 50 students a year. They have 150 postgraduate seats. And the annual budget at that time was 550 crores. So many of those, I don't think that should be our ideal. Center of excellence, I don't know what the definition is. Many people regard super specialty, that is a center of excellence. This term is used all over the place. I don't really know what it means. All I would say is, for example, if you take Vellore Medical College, it's a rural orientation there. Mahatma Gandhi Institute in Sevagram, that's another place, 800-bedded hospital. They are doing good work there. There is no reason this inquiring mind, critical thinking, this can be done in these places. For example, a false registry, it doesn't require the All India Institute type of, but extremely useful. If you can produce a dozen guidelines, which will prevent 50% of the falls in old people, you have made a great contribution. It doesn't require this center of excellence. So I find that that approach, interest in fellow human beings, getting them better, and not just teaching alone. Discoveries of this kind, discovery-oriented thinking, if I may put it that way. I think that is necessary for us. Otherwise, I cannot see at this rate 17,000 crores worth of equipment being imported every year. How is it we are going to make it available or accessible to majority of Indians? That I cannot see that happening.
You are saying that even our field workers, like the junior public health nurses, junior health inspectors, even they can do research?
Of course they can. They will need help, guidance, all that should be provided. Community medicine, essentially, that is their responsibility to do it. If they need help in cardiology, for example, get a cardiologist to come and help. Some particular type of palpitation is there, how to solve this problem, not to treat a patient. But if there is in a particular area, a number of patients with palpitation, they are coming. And the doctor sitting there will be treating that patient. But he will not know whether this palpitation is happening in 3-4 other houses. Now that information is concerning the community. We should have, that is where the community medicine comes. What is applicable in an individual and what is applicable in the community, they are two different things. I was telling somebody the other day, take for example, tuberculosis. I used to think that tuberculosis, the decline, all this is because of the chemotherapy which came, streptomycin, Isolax, PAS. I was in the final year of medical college, very great discoveries. We had no way of treating tuberculosis earlier. Send them to sanatorium, to Nagarkov. This is what we used to do. There was no treatment. But when this came, we all rejoiced. It's a great advance. And tuberculosis control, which came subsequently, many times I have claimed it is because of this therapy that we have introduced. But this is completely wrong. If you look at the New York, they have got statistics there. By 19th century, the end of 19th century, 1840, 1850 onwards, you can see the incidence is dropping. By 1940, it is extremely low. There is even some doubt whether this treatment was necessary. Even without that, tuberculosis would have practically disappeared for various other reasons, better nutrition or better shelter, whatever the reason. It is not this treatment. But then, is there no place for treatment? No, it is necessary. Treatment, whether it is lobectomy you are doing, whether you are giving this triple drug therapy, they are necessary for individuals. That is where that is required. But for a community, when you are talking about 1 million people, these drugs, and they are not the answer. So therefore, that difference must be made.
Thank you, sir. So there's one interesting question in the chat box. So what has been your motivation to work hard? Have you always received rewards for your work? Have you ever had to face setbacks in your career, and how did you approach them?
You cannot, in India, as you know, Nishkama Karma is very much praised. That is, you work without expectation of reward. My answer is that is an ideal, but we cannot work without expectation of reward. We have to live, we have to support a family, we need money when we get sick to get treated, etc. So reward is necessary, but you don't work only for the reward. In other words, you may also work without any reward. I do lots of things where I don't get any reward at all. Lots of time I spend, I don't get any reward from that. I do, so both are necessary in the same life. They are not incompatible. You work your salary, you manage your life, but you spend a lot of time doing many things highly interesting, which brings you no reward. But that makes life interesting, worthwhile. So that's a good philosophy. Nishkama Karma modified for our times.
So how did you face the setbacks in your career, whether you have had any, and how did you face them?
I'm sorry?
Whether you have had any setbacks in your career?
Yes, oh yes, I have had many setbacks. For example, when I came back from abroad with after my training in surgery, 1962, I couldn't get a job. I did not want to work in a nursing home. That is something I never liked. I worked there, collect money from patients after every operation. That somehow psychologically I am unable to do it. So I never wanted that. I wanted a hospital preferably a teaching hospital where I could work on a salary. I simply could not get a job for 3 or 4 months. I appeared in a number of interviews, public, PSC, I wanted anywhere I was willing to go in India. But that was a big disappointment for me. Fortunately, my brother put me up those months in Bombay. So that was a very big setback. Ultimately, the PGI Chandigarh was opening at that time, 1963, early 63, end of 62. Actually, I went for the interview there and I got a job there. But something like 3 or 4 months, I didn't have a job. So like that, this happened in a different sense. Many years later, after cardiac surgery training, I came. I got a job in Safdarjung Hospital, Delhi, and they told me that they were keen to develop cardiac surgery. But I spent a year there without doing any cardiac surgery. It's a big hospital, very busy. I learned many things there incidentally. For example, these are worth remembering this, because all my cardiothoracic training was in the United States. So when I came back and took this job in Safdarjung, I had no cardiac surgery there, thoracic surgery. So I found that one night I was called, I didn't have a phone, there was no phone available. You had to apply for a phone and wait. So I was waiting in the defense colony, I didn't have a car, because cars you had to book and wait. So the ambulance came to call me. When I went there was a child, a 2-year-old, desperately sick.
Please mute yourselves. Shiny Julian.
Can you hear me?
Yes, sir. Yes, sir. Please continue. Sorry, sir.
Now, this child was a 2-year-old, desperately ill, and breathing 70 times a minute. And I had no idea. There was a chest X-ray there, and one hemithorax was, the right hemithorax was opaque, and a shift to the mediastinum. So I knew there was some fluid collection there, but I had no idea what this disease was. And the pediatrician has written there, referred to the thoracic surgeon. So I had to call that doctor. I did not know what it was. I had never seen this before in my thoracic surgical training in Washington. So I asked Dr. Malik, please tell me what I don't know. Oh, this we see all the time. It's a staph empyema. We simply put a chest tube. That's it. That's what she told me, and she put the phone down. So I put a chest tube, and remarkably, the next day morning, this child was sitting up. They were relieved. But this was something which I had never seen. And that was some of the things I learned in Safdarjung, because after a week, I found another child like this, 2 children with staph empyema, which I had never seen. Then I found both these children came from a place called Seva Nagar, which is very close to defense colony where I was staying. And I went there and I found these were a colony built by the government, Delhi government, single room apartments where poor people were staying. And there was only one small window on the top for ventilation purposes. So in winter, they always put a brick and close it. So the women staying in this room, the man goes out for work all day. He's not there. And this woman is sitting there. There is a smoke, full of smoke, that room, smelling, breathing this air. And the women get emphysema. This is a paper published by Dr. Padmavati, which got international attention. Young women with emphysema, it is unknown anywhere else in the world. She published a paper on this. That is where these children develop staph empyema. They get pneumonia, unresolved, the lung tissue breaks down and develop empyema. So this was a discovery for me in working there for a year. But I couldn't do cardiac surgery, so I shifted. I came to Madras IIT. They gave me a job as a professor in biomedical engineering. I had some interest in that. And railway hospital I was operating. These are not regular type of work, difficult traveling between these 2 institutions. Then only I came to Chitra Center. 1 year I spent in Chennai without being able to do, because railway hospital, you cannot do any research in cardiac surgery and so on. And IIT Madras, where I thought all technologies could be developed, that is only a place for teaching. There was no way you could develop a device there. You can teach everything about the heart valve or oxygenator or an aircraft. All these departments are there: biomedical engineering, aeronautical engineering. You can teach, but you cannot design and make a prototype of an aircraft. You cannot make the prototype of a valve. That is not possible there. So that I was not interested in seminars and lectures and so on. So I took this Chitra Center job. There was nothing there at that time, fortunately. So I could build it the way I wanted. So I had plenty of setbacks. But if your objective is clear, see, something like I have found in my experience in the airports, as you all know, big airport, your gate number is far away. It's a long distance. But if you keep walking with your baggage and you know which is the gate that you're going to, sooner or later, you will step on a moving walkway. You will be moving very fast. Without you doing anything, you will be at that gate. This happens in life also. So Shakespeare said there is a tide in the affairs of men. I think there is some truth in that. If you know your objective, what you're trying to do, and you keep on working in spite of setbacks, then surely your turn will come. You will step on that walkway and you will be reaching your gate.
Indeed, sir. Thank you for those inspiring words, sir. It is especially important for our youngsters to listen to these words because many of us face setbacks in our studies, in our careers, and it is easy for us to give up. So looking at your accolades and your career profile, it seems absurd to think that you have gone through setbacks too. And it is indeed inspiring for us youngsters to keep trying in our careers, to keep our vision clear and to have an objective in our career and in our lives, sir. Sir, we have a few more questions. So as a person who spent much of your student career in the West, in your experience, is there a difference between the teacher-student relationship in the Kerala setting compared to the West? And anything which you have wished were different here in Kerala or India? This is a question from Government Medical College, Kollam.
Government Medical College, Kollam.
Yes, sir. The student from Government Medical College, Kollam has posted this
Comparing
question.
The West.
The teacher-student relationship, sir, anything which you have felt is different and or could be different here?
That's a good question because the relationship in the West, especially United States, there's a very friendly, free type of association. The first name terms the student will be addressing his teacher. So that easy, friendly way, that is much more there. The hierarchy here is much stronger. We are not, I wouldn't dare call my teachers by first name or anything. It is unthinkable. Asking questions, for example. Many times when I was a medical student, I was afraid to ask questions because I thought it will expose my ignorance. And I may be made fun of. So I would keep quiet. I would come and look at books and try to find the answer. This was very common. Whereas this is not at all the case they are much more open. They ask questions, the answers are given. The teacher himself will say, oh, I don't know about that. We'll have to check it. So they will admit very plainly that they don't know. That easy relationship we don't have here. And secondly, in the Western countries, especially universities, I'm not talking about undergraduate so much, postgraduate level. There is an atmosphere in a great university. That is, I'll give you Ahmed Zewail. There is a great Egyptian chemist who got Nobel Prize in 1990s. Now, our Indian National Science Academy gave him an honorary fellowship, and then he gave a lecture there. And he said, Egypt is a country like India. He said when he finished his PhD in Cairo, he wanted to do some postdoctoral work. So he went to his professor and told him, I want to do some postdoctoral work. So I want a fellowship. So what was the work that he wanted to do? Suppose you take sodium chloride, silver nitrate. There is a white ring which forms there. Now that ring forms within seconds. Now, Dr. Zivil wanted to know how it started. Suppose that ring is a building. When did that first brick, the foundation, when was it laid? He wanted to study that, the beginnings of that chemical reaction in molecular terms. That's what he wanted to work. So the professor listened to him and said, if there is anything in that, somebody would have done it already. And he dismissed him. And in fact, in his lecture, he said, I'm sure that this is what happens in your country. He said that also. Anyway, after a couple of years, he kept on applying. He got in Caltech in the United States. He got a postdoctoral fellowship. So he went there. And he went to the professor. What do you want to do? So he repeated all this. So that professor's reaction was very different. He said, well, that's an interesting idea. Now here is a go and do it. That was the reaction. It was an ordinary lab, nothing very special there. But what happened subsequently, that's the important thing. So he went there, suddenly he realized the professor has given him that responsibility to find the answer to this. So in the next 3 or 4 months, professor never called him and asked him, what are you doing? He said, this problem he was reading, attending various seminars in mathematics, physics, talking with people during lunchtime. People carry brown bags with their sandwich, sit down under a tree and talk. This went on, a lot of discussions like this, not formal classes. Of course, classes also he attended. But slowly he learned.
Request all to mute yourselves, other than Valitan sir. Sorry, sir, for the interruption. Some of the participants have unmuted themselves. Please mute yourselves. Sorry, sir. So please continue.
These discussions, he found that it is possible, a chemical reaction of, say, 5 seconds, that can be split into 10,000 bits mathematically, theoretically. It is feasible to do that. And molecular reactions can be recorded also during this. So there are methods, laser instrumentation, which would do it. So like that, he found, he did not know these things earlier. So discussions in different departments, talking to different people. So he had a fair idea that this could be done, that this reaction could be tracked in some way. And with all this, when it was, then he went to his professor. So he said, how is work coming? So he said, sir, I have done all this. I need some equipment I have, but I need some others I can use, go to another lab, but I need to buy. Immediately it was sanctioned. So cut the long story short, Ahmed Zewail, who did all this work, 6 years later, he got the Nobel Prize for an area called femtochemistry. That he was the founder of that. Now, this kind of atmosphere, he said, that is what is lacking in our place. If you go to a central university, forget our state universities, we always say we have no resources. I don't entirely agree with that. But even if you go to big central universities, there is no atmosphere like this. We are unable to create it. Not just one person or one department. When I all put together, the total is much bigger than the individual.
Sir, hello. Sir, you're not audible.
That atmosphere is necessary. That's what they have. That's what we don't have.
Thank you, sir, for the answer. From sir's answer, it is evident that it is not just a creative mind that is necessary, but it also a creative atmosphere, or an atmosphere that nurtures that creative mind. So this is a message to all our institutions and all our teachers to foster this creativity among our students, and to develop that spirit of inquiry, or to nurture that spirit of inquiry among our students. And it is also an inspiration, sir, to know that you have also faced issues as a student while asking questions. You know, even we also face such instances when we have to go back and refer to our Western textbooks. So I hope that there will be a change in this scenario. With initiatives like Quest for Excellence, we hope that there will be an initiative, and that our students will speak up more and will gain more confidence from their teachers. Because-
Dr. Mariam, I am having a question for sir.
Yes, indeed.
Sir, in fact, you have during your talk, you have mentioned that there is not a single drug discovered in India. Sir, you have done immense research in our Ayurveda also. So I would like to know, what should be our approach, because our core competencies we need to tap, and what are the best ways to go forward? Because I personally feel, sir, that all these our core competencies, if we again look back and try to understand, I think we will find some answers to some of the fundamental questions which we are grappling with in health sector. Over to you, sir.
Drug development, the only drug that I know which we developed, which was effective, was urea stibamine for treating Kala Azar. That was discovered by Brahmachari in the Calcutta School of Tropical Medicine, which was effective. I believe it is still being used. That's the only drug that I know which was effective in treating a disease. Otherwise, we have not done. Coming to Ayurveda, as you know, this Ayush department is there. The government is going all out to promote it. I took some interest in this long after when I was 65 years.
Please mute yourself, Dia.
I took up Ayurveda when I was 65. I had stepped down from my vice chancellorship. So that was the time. Until then, I had paid no attention to Ayurveda. I took it up for several reasons. One was I never had any interest in practicing Ayurveda. I took interest for the following reasons. One is Ayurveda, after the, say, 6th century, it has been in a kind of stagnation, because Unani, during the Islamic rule, Unani was the official system of medicine. So Ayurveda has no support from any government or any other organization. And then the British came, they thought, except the medicinal plants, all the rest was hocus pocus. They discouraged the practice of Ayurveda. So for something like 1,000 years, Ayurveda had no support of any kind. So the Gurukula system, they all perished. We didn't have universities like Nalanda, etc. So it was a dark age for a very long time. It is only after independence Ayurveda found its own strength, and it has been developing very fast. Now they have more than 20,000 graduates getting BA, MS a year, etc. I became interested for a different reason. I was always worried by the time this long phase, 1830 onwards, why is it that we were not able to make any contribution like Raman effect in medicine? The very best students go into medicine, work extremely hard, and they do very well in clinical work. When it comes to these diagnostic method or a treatment method or a surgical method, inventing something, not very basic work like Raman effect, but there has been not a single one which received global attention. Why is it we are like that? And in fact, I started in around the 60s, I started wondering. There is a scientist called Shockley, S-H-O, Shockley, S-H-O-C-K-L-E-Y, Shockley. He got Nobel Prize in physics. And Shockley in 1961 or 62, he made a statement that the groundbreaking discoveries, which completely changes the practice of science, these are only done by white people. Others cannot do it. That's a plain fact. He's bluntly said this, and he was abused and criticized and all that. I was in the United States at the time. But I started wondering, maybe he was right. How is it that with so many of us taking medicine, we have not been able to solve any of these problems? But then it occurred to me, I never discussed it with anybody, but I thought, after all this, Western medicine came here only 250 years ago. We have been practicing medicine for much longer period. I knew nothing about it. People still go to Vaidyas and get treated. And many of them claim they're getting better. So I should take a look at this. Was there anything in this system? That is where I started looking at any original work done. Charaka, Sushruta, these were names to me. I didn't know what they contained. So I started reading. There is an English translation of Sushruta Samhita, Bhishak Ratnas. I was in Chitra at that time, actually. I was asked to give a lecture in Kottakkal for their Founders' Day. So I picked up this book, I bought it. I read that. Then it occurred to me, apart from getting my material for a lecture, I found that here is a book. Sushruta lived around the time of Buddha or even 100 years earlier. He's that old. He's older than Charaka. In that book, all these surgical techniques, like rhinoplasty, everybody is talking about. There are so many other disc fractures and dislocations. They are all described, different types of dislocations. Perineal cystolithotomy, all kinds of, there are something like 120 surgical procedures, incision, drainage, that is there, fistula in ano, like that. So some 120 surgical procedures. Some of them are very original, like nasal rhinoplasty, for example, is internationally known, perhaps the only Indian contribution to international surgery. It is known as Indian technique. There is a long story in that. There is no time, otherwise it's a very interesting story how this was discovered, the rhinoplasty in India. But he also 120 instruments, 20 sharp and 100 blunt instruments he had described. Dimensions are given, how to use them, how to preserve them, clean them, everything is described. It is there. Then he surgical training, practical training, using like a pumpkin, how to make incision, how to use a special type of forceps for extraction of foreign bodies. All these instruments are described. Now, these were all done at a time when he was not taking it from anybody else. It's not that he invented all these. Many others also would be contributing. So if that went Charaka, of course, I won't go into details of this. There was enough in these two to convince me that we were capable of originality. That was absolutely convincing. Nobody can deny that. So later on, I wrote, I studied, I took a fellowship. I spent a lot of time on that. It was worthwhile. Now the question, I have not gone into treatment with Ayurvedic drugs. That was not my interest. But I do know that these people who wrote all this, they could not have written so much, like Charaka talks about 1,000 medicinal plants, different types of preparations. Certain areas they cannot, for example, acute emergencies. Ayurveda is not suitable for that. So that we should know where Ayurveda is applicable. In my view, this is my hazarding my opinion, I would say that chronic degenerative diseases, which is very important, like Kerala, 12% of the population is above 65. So we have to worry about that degenerative diseases, whether it's locomotor system, central nervous system, and all these systems. We have to worry about degenerative conditions. And there very definitely, Ayurveda may have something to contribute. I'm not very sure whether we are doing the right kind of research on this. Not enough is being done because Ayurvedic colleges, there is no research. And modern medicine, I tried, we have an Ayurvedic biology, which I got the government support. And that we have produced good results. For example, the Ayurvedic biology, it is modern biology, including molecular biology. It is Ayurvedic only in the sense, the cues always come from Ayurveda. To give one example, as you know, Ayurveda, there is a fundamental concept, Vata, Pitta, and Kapha. These are actually constitutional types, what we call phenotypes, certain types of physical features, behavioral features, mental features. When they put together, that is Vata Prakriti or Pitta Prakriti, like three Prakritis. That is what phenotype is. It has nothing to do with the bile and phlegm and all that. That's a big mistake because the name have been misleading. Now, if you have these Prakritis, the importance is these Prakritis are prone to getting certain diseases. That is the one. Secondly, the treatment that you apply, the response will be different in these three. So an Ayurvedic physician has to determine this Prakriti. before starting treatment. This was prevalent even in Buddha's time. Now, the determination is done by the Ayurvedic physician even today, based on questioning, inspection. There are no tests or anything. They spend half an hour, 45 minutes with an individual, and they decide based on these traits which are described, physical, mental, behavioral. These are all described. They will say this is the Prakriti. Now, this we could not take it further. Is there biological evidence for this? This observational decision that you have made. Is there any biological evidence for this? There was no way we could produce at the genomic level. So when I was a medical student, there was no way. There was no double helix. We could not know genetic mutations. Genotyping was not possible. SNPs, we did not know. There was no way we could produce biological evidence. Today we can do all this. All these techniques are available. So in this Ayurvedic biology, I'm just giving an example. This was a question we took up. It was funded by the government, that project. So we do this, it was done in 3-4 institutions, at CCMB, Hyderabad, University of Pune or Manipal. 4 institutions took it together. We had samples collected from Bangalore, from Udupi, from Pune. Subjects were selected, and we did SNP mutations were studied. And that paper was published in the Nature in 2015. And that was one of the highly cited papers that year. And we showed very clearly that there is a genomic basis for this dosha prakriti. Now that it has no practical application immediately, but it takes a lot of time, a lot of effort. But this has only just started. It is to be, unfortunately, it is very few people are interested. Modern scientists taking interest in this, very few. Ayurvedic physicians are even fewer. So there is no, it is not because of the weakness of the concept. It may fail because of the poverty of response. That we cannot do anything because it's not a fashionable subject.
Sir,
Thank you, sir.
Thank
you, sir.
Thank you, sir. It is indeed heartening to hear from you that we also have a history or a past in which we had a rich spirit of inquiry which was alive in our community. So this spirit of inquiry is indeed buried somewhere in our minds. So we hope that our students will be inspired by this message. So we have few more questions for you.
Sir, how much time we are having, sir? Because
yes, I have kept the whole morning. You can ask.
Thank you so much, sir. Yeah, because your time is very valuable. So students are asking. So I am requesting Dr. Mariam and our team. Yeah.
I spent the whole morning with them. I'm happy.
Okay. Thank you so much, sir. Thank you. Over to you, Dr. Mariam.
Thank you, sir. There's a question from Anasuya. From a medical student's perspective, what are the basic principles doctors should never sacrifice in their quest for academic excellence? How can we have a healthy academic quest? Hello, sir. Please.
Your audio is weak, sir.
Valitan, sir, your audio is weak, sir. The mic.
Can you hear me now?
Yes, sir. Yes, sir. Thank you.
Am I audible?
Yes, sir.
Yes. Now that question is is it about medical ethics? I was not very sure that I understood it.
So I believe it's a question which deals with unhealthy competition and sometimes lacking the right objectives or the right purposes in.
You can again read it. You can again read it.
The question is, from a medical student's perspective, what are the basic principles doctors should never sacrifice in their quest for academic excellence? How can we have a healthy academic quest?
A doctor should be a good citizen. That a good citizenship, I think our constitution itself says what a good citizen should be. Awareness of the society. You don't do something which is good for you but is bad for the society. You shouldn't do that. So that kind of citizenship that a doctor should be. I think that is not happening today. Many of the doctors, they may get a degree, they may practice, but they're not doing what a good citizen should do. It's no use saying the lawyer is also like that, teacher is also like that. That is all true. But as far as a doctor is concerned, if he can behave like a citizen, that is automatically takes care of all the societal interests. You would not do anything which would hurt somebody else. That is all forgotten today. And the doctor's challenge today, a couple of years ago, Professor Nandi from Delhi, who started the National Medical Journal, he has published a book called Doctors, Saviors or Predators. I wrote a chapter for that book. Now, this is all about this, the public opinion about doctors is alarmingly declining. The trust we used to enjoy, we no longer enjoy today. They never accept a diagnosis, they will ask 3 others for opinion. So the whole picture is entirely different today. Now, to regain that trust, it's not an easy thing. First of all, you have to be up to date, you have to be competent. You're treating, you know what you're doing. I saw Dr. Antia's colleague from Upaleka a few years ago in Maharashtra. He did a study of prescriptions given by doctors. I'm talking about our modern medicine, not Ayurveda. And it is alarming the kind of practice, the prescriptions being given by doctors. Banned drugs, dosages are wrong, all kinds of things are there. This is being given by doctors. So the doctor has to, first of all, he has to be behaving as a citizen. That is very important. Second, the competence, professional competence. That is, this Observance studies. That's not an isolated thing. It must be happening all over. So that we have to update ourselves. I know the various continuing medical education conferences and so on. I don't know how effective they are, whether it is compulsory. There is a relicensing, the legislation passed by the government. But that is not working very well as far as I know. In fact, that is an area which requires a lot of attention, because once you get an MBBS degree, you can practice all your life without any relicensing. Now, this legislation requires you to do that, but I'm not very sure whether it is happening. It is in public interest that all doctors are relicensed. That means they have to have that basic knowledge. If some techniques have changed, they should know that. Some drugs have banned, they should know that. That is the only way you can serve the public. So in all this, there is a lack of attention. In fact, in the relicensing, when I saw it, I was vice chancellor here when it first came. A certain type of coursework, etc., you have to credit hours you have to take before you can take this test. But those can be given by a long list of people. It can be given by IMA, local IMA, somebody, this medical college. Anybody can give that test. It is taken so lightly. But that should be, I recently suggested the National Academy of Medical Sciences, its 60th Golden Diamond Jubilee is coming. That's an organization which is not doing anything, looking for a job. So I was suggesting to them, why not a prestigious organization where all the excellent doctors, they are fellows of that academy. Why not put them in charge of this, all this relicensing all over India, how to do it properly, test them. And today the testing can be done extremely well. It's not just yes and no, questions like that. Questions can be framed in such a way, only somebody who is actually doing it will be able to answer it. We know there are people who can do that. So something like that, so that the public knows that we are taking care of the standards of the profession. They can trust us. So that these are all things which we should do, professional side and citizenship, that we behave like a good citizen. I think if these are all, we cannot make people good. Even great saints have failed in doing that. But we can make an effort. Citizenship, and secondly, professional integrity and competence. These are the things which we can do. We should attend to that. There are many bodies in India which should be doing that.
Thank you, sir. Sir, the next question. How far do you think one's academic excellence as a medical student can influence his or her career as a good and sincere doctor?
Do you say that
Once again,
again, please?
It is from Sona. How far do you think one's academic excellence as a medical student can influence his or her career as a good and sincere doctor?
No, there is no necessary correlation in this. Academic excellence, getting medals, first position, these are all there, but that has no necessary correlation with excellence as a good doctor. It's not, they are mutually exclusive. I'm not saying that. A person who has done extremely well academically could be an excellent doctor. Yes, certainly. But to be a good doctor, that academic excellence is not essential. It's not necessary to be a super intelligent, not like a mathematics. Ayurveda, modern medicine, we are intelligent people. That is enough. There is no need to be a genius. We should work hard and all the good citizenship. If you do that, you will be a good doctor. Patients have confidence in you. They come to you. And in fact, bulk of the medical profession should be such people. The people who are creative, contributing new things, that will be 10%. Even in a country like United States, it is like that. If you take a class, the super intelligent who make great contribution, they are very, very small. But the rest of them, they are the people who carry the burden, and they do very well.
Indeed, sir. Thank you for the inspiring words. The next question. Good morning, sir. How can the students cope with stress? Have you ever faced such situations in your life? I can repeat the question. How can the students cope with stress? Have you ever faced such situations in your life?
No, I have not. I had faced difficult situations, but I had never had any stress problem. Because I like to, if you can believe it, I work through stress. I can do that. So I have never faced that. I would say sometimes you get tired and all that, you listen to music. There are things which go and see a movie, go and meet with friends who are very witty. There are some people who can make you laugh. So seek such company. So there are so many ways you can relax. And we should have that opportunity. I like to read, for example. It's fun reading. Very nice, like Somerset Maugham. You read a novel, it's a wonderful. It's a stress buster as far as I'm concerned. But each person will find his own. The best thing is to have some friends, good friends. That's the best way to relax. Who can, not with any agenda or anything, just free, sit down under a tree and chat. That is a very great experience. You feel relaxed, refreshed. That's the best way to relax.
Thank you, sir. Sir, you said that you have never experienced stress. So was it that you always enjoyed your work?
Sorry?
Sir, you mentioned that you have never faced stress as an issue in the work with respect to work. So is it that you have always enjoyed your work?
I had a focus. So difficulty, for example, when I came back, I gave a specific example. When I was leaving the United States, I was there for a second time. I went there. I spent about 8 years. I was keen to come back to India. And many people thought it's a silly thing. My own boss, Dr. Hufnagel, very great surgeon, he said that Indian virus will destroy you. I remember saying that. But when I came, I had the difficulty in Delhi. I could not do anything. Madras, I could not do anything. When Chitra Center is not easy, there are a lot of problems there. But all these, it didn't produce any stress. I was determined I must do this. If people criticized, make crack jokes, for example, Chitra heart valve, it was a joke at that time in Trivandrum. In a place like Trivandrum, heart valve is being developed. This is only, in fact, there was a meeting in medical college, early days. We had just started working on that. You know the status of Trivandrum. There is no great science institution. VSSC, because it's isolated, they don't deal with any of us. So that in that meeting, a very senior professor, he stood up and asked, Dr. Velithan, you mentioned you are starting this work on the heart valve. Is the heart valve manufactured in Britain? So I said, no, it is not made in Britain. So then he made a remark that if it cannot be made in a country like Britain, you think this is going to work in a place like Trivandrum? So very sarcastic. Now that, I had plenty of such questions and remarks, but this is not because they disliked me. This comes from a deeply ingrained conviction that we cannot do this. That is, that Shockley, what he said, only the white people can do these things. That's why this professor who was talking to me, he was convinced that it is only white people who can do this. So if Britain could not do this, how is it you are going to do it? It is a deep inferiority complex. That manifests in many different ways, hostility, questions, all that. But you should forgive them. It's a good thing to, when you face these situations, I'll be very frank. The way to handle this is not to get angry or ask counter questions and all that. When you walk on the beach, for example, this is actually a quotation from Swami Vivekananda. If you walk on the beach for half an hour and you come back and you lick your lips, it is salty. But you never felt anything. But that breeze which was blowing on you, it has salt. You taste the salt. But that breeze is fatal for a mosquito. They cannot survive there. So when you listen to these remarks, I have plenty of them. You imagine that this salt breeze is coming. It makes no difference to me. It doesn't touch me. Now, if you mentally tell yourself, then there is no stress. You just keep on doing what you are doing. That's it. I have practiced it and it works, I can tell you.
Thank you, sir. So it's all about having your purpose clear in life, isn't it, sir?
Yes, that you should have, yeah.
So we have a question from the nursing side. In your opinion, what may be the suggestions to revamp nursing education in Kerala? In your opinion, what may be the suggestions to revamp
Kerala
nursing
is already the
education?
most advanced in nursing. I'm not sufficiently well informed to give an opinion on that. I wish I could, but I can't give any good suggestions.
So shall we move on to the next question?
What sir is appreciating, in fact, at this point of time, the nursing sector itself, whatever work they are doing is, well up to the mark. And through such initiatives, if some of our colleagues from the nursing sector, if they find out some kind of an innovative solution, that will be the next benchmarking. So they need also to be keep thinking, what about our public health program or our other programs, patient care, the way we do,
whether we can take it at a further next level. So that's the message to all of us. So that is what I understood when sir had very impromptu gave a response to all of us. Thank you.
So
Yeah, over to you, Dr. Maria. Yes.
Thank you, sir. So I shall move on to the next question. It is from the Department of Radiology in Government Medical College, Manjeri. So in the current scenario, I see a lot of doctors going after private jobs for monetary benefits. This has led to a decline in the number of faculty in government colleges. What can be done to prevent this state of affairs and get more doctors into teaching and research for the benefit of coming generations of doctors?
This is a big problem that we always had this. But government hospitals, we can never match the private sector. That we have to realize. Like Chitra Center, for example, a cardiac surgeon working there, we work for a salary. And in the private sector, you make much more money. So we cannot do that. But we have to make it attractive in other ways. It cannot be fully compensated, but there are people like myself. I don't want a lot of money in a private sector environment. I want a teaching hospital environment with a lesser income. There are a lot of people like me that government hospitals should make life good for them. For example, give them academic facilities, ability to attend a conference. I may not be able to pay from my pocket to attend a meeting. Things like that. There are a lot of things you can do, not cash benefits necessarily, but many other benefits you can give. Subscriptions for a learned society, for example. There are many things like that which makes help in preparing papers, for example. Sometimes when you write a paper nowadays, these journals, they ask for payment, open access journals. The doctor doesn't have the money to pay for it. That should be paid. That kind of assistance make it academic life attractive. You can get good people. Because by giving more money, it is a great mistake to think you will get the right kind of people for a teaching job. You need the right temperament. Those are the people you need. And they should be given assistance of this kind. I can't think of anything else. That's the only way to keep them. There are good library facilities, access to the library, electronic library. All that should be given. Computer assistance. Like this, you can make academic life easy, attractive. That's feasible. That we should do.
Yes, sir. Thank you. So there's an interesting question from Government Medical College, Kannur. Sir, do you feel that being a female doctor and domestic responsibilities limit women from doing research and pursue academic excellence? Does gender play a role? And also, what change would you like in the medical education in Kerala today?
Gender, yes, there is it's a big question. Gender discrimination. There is a glass ceiling. They don't come up to the top position. This is a matter of great concern. Our Indian National Science Academy, we had a committee with Mehta Bamji as the chairperson on scientists, including medical scientists, not practicing doctors. But so that is a matter of great importance. Some of the things which surprisingly in the scientists, I don't know how far it is applicable to medical. We all felt, as you know very well, the university ranking when it comes master's examination and all that, always girls are the top position. But when it comes to the director, principal, that level, there are very few girls. Why is it happening? And this Mehta Bamji, she's a very famous nutritionist from Hyderabad. She's a Parsi lady. And that committee, they have really gone, collected data, interviewed people and all that. And they have found that one of the surprising findings, we all thought they get married, pregnancy, children, they take a few years are gone. And when they come back, that re-entry is very difficult. They cannot get a job. If they get a job, these years are all counted away. They will again starting as assistant professor. So disadvantage. So that has to be taken into account in their career advancement. So like that, there are re-entry has been some recruitment rules have been changed in the government and so on, something we have done. But one of the things we found in the response from so many of these, they located these master's degree holders, got their response and all. A good percentage, I can't remember the number, they said, we didn't want to go into all this because it is so much of tension and politics and all that. We didn't want to get into that. So they left it. A good number has said that. So I don't know it's a question of whole societal attitude. At least government side, there is a great awareness today that which was not there 20, 30 years ago, even though we had one prime minister and all that. These attitudes are still there. But I don't see any reason why they cannot be as good as anybody else. But a lot needs to be done. I'm not sure of any specific measures in our Chitra Institute, for example. We had a woman director, so we have tried as far as possible, and they do just as well as anybody else. No reason to discriminate.
Thank you, sir. So we have a question from Dr. Jay Prakash, GMC Thiruvananthapuram. Academically and financially, Western system is more attractive than ours. Then what made you to work and settle here than in the West?
Sorry?
Academically and financially, the Western system is more attractive than ours. Then what made you to work and settle here than in the West?
What made me come back?
Yes, sir. Yes.
Yes, sir.
Yes, that's the question, sir. So what made you come back and settle here?
No, what made me come back, partly I like to live here in India. Even though I spent some 12 or 14 years abroad, I like life in India. That is one basic reason. The second reason is, if I was in, say, Washington, Georgetown University, I had a job in the faculty. If I did an open heart operation there were thousands being done there. I have done one. Similarly, a paper I published in a good journal. There are thousands being published. I'm also just publishing one. But suppose I came back to India, in some place, Pondicherry, Trivandrum, somewhere, I do cardio surgery is not being done. I do an open heart operation successfully. The significance is entirely different. Because that means I have set up an operating room, intensive care unit, anesthetist, blood bank, the whole lot, cardiac cath lab, everything has been set up. Then only you can do that one single case successfully. Now I have done that. That's what it means. So I thought if life is to have some significance, that's what I should do. And especially I'd like to live there. So even though difficulties were there 2 or 3 years with my wife and 2 children, year after year. In fact, my daughter, she's a professor of pathology. She used to ask, I was Delhi 1 year, then come to Chennai 1 year, coming to Trivandrum. So she would ask me, where are we going next? She would ask me. That was the kind of life I had. But all that becomes bearable when you know that you are moving in the right direction.
Thank you, sir. So time is coming to a close. We have just 5 more minutes. So on this occasion of World Health Day, sir, our students are listening to you, our faculty from the medical education are listening to you, and also our health officers, the medical officers, program managers are listening to you, as well as our field functionaries, our junior health inspectors, the health supervisors, they are also listening to you, sir. So what is a message you have to give for each of these health functionaries, sir?
No, they are our partners. You know, it is a team. The individual doctor treating, doing everything, that's all gone, long gone. So if you have take anything, whether it is COVID or any type of management, we need all these partners, or healthcare professionals, whether it is allied health, whether it's the field workers. Otherwise, for example, we have the primary, secondary, tertiary level care and all that we talk about. Or, so for example, a public health management. If there is an outbreak of a disease in some place, let us say a primary health center, a doctor is sitting there, he has got 100 patients all around him. Somebody has got a rash, a fever. He has to treat, but he has to attend all these people. But it may well be that 5 others in that neighborhood next to his house may be having that kind of rash. So a doctor has to have time to ask, does anybody else have it in this? That's a separate public health approach. There is no way our doctors who are overburdened, they cannot do this. But we need these health workers for this, that kind of inquiry, because they are friendly, they know the people in that area. Suppose 5 or 6 people have that kind of a rash. That could be indication of a very important disease beginning there. That starts with them. In fact, in Karnataka, I was in a committee for the Karnataka government. We had suggested, we used to have a public health system in Travancore also in the old days. Public health was separate from medicine to do all this. If in a general hospital, a patient came with some, what we think is infectious disease, doctor has no time. He has got so many patients around him. He's only trained to treat patients. But something like this, we had these people belonging to the public health department. They would depute somebody to go there. They know how to go, what kind of questions to ask, how to ask. All these they are trained, health workers. The doctor is not trained to do this. And that information will alert you that there is some infectious disease starting here, an outbreak. So this was done at that time. I don't know how well, but certainly we had. In Karnataka, we have suggested they should reintroduce. They also had old Mysore state that they stopped. They integrated with medicine, which was a mistake. So I think the importance of working in the field, that is growing all the time, because more and more hospitals become well equipped, centralized, all that goes on but at the same time, this if you're not paying attention, there will be a real problem at community level. So all these different categories, they're extremely critical.
Thank you, sir, for all the inspiring messages, all the answers which you have taken time to answer, I mean the questions which you have taken time to answer, sir. You not only shared your experience, but also really opened up your heart to us. It matters a lot for our students to listen to your words. And indeed, as our about 67 years junior students are listening to you, sir. You are belonging to the first batch of medical students in Kerala. And now it is 2021 and almost 67 years later. What is one message you have to give them on World Health Day?
I think it is a great privilege to be a doctor. You work and enjoy. That's what I would say. That's all I have to say.
Thank you, sir. So I hope we can conclude the session. We do have few more questions remaining. Is it possible to take those questions? Or we should?
Sure, you ask. Yes.
Okay, sir. So I will just will take the remaining questions also. So a question from Dr. Lulu, Community Medicine PG in Malabar Medical College. Doctors themselves are having multiple risk factors for non-communicable diseases. Could you give your valuable opinion on integrating yoga and yoga therapy into allopathic system of medicine and modern medical academics?
I think this some integration can be done, but on the whole, these integrative experiments have not worked out very well. according to me. Because even now, many hospitals, as you know, they have Ayurveda as part of their co-location, they call it. This has not been a great success. But I do know that, if, for example, stress release, say hypertension, for example, in certain circumstances, yogic practice can help in bringing down the blood pressure, or maybe reducing the antihypertensive drugs that you are giving. It's possible. That can be done. But this, I don't know. I know many hospitals, including five-star hospitals, they have a Ayurveda yoga section. But there has been no kind of a follow-up study how well they have done. That I have not seen. This co-location has been going on, is still going on. But there is no study that I have seen the performance of these over a period of 5 years, how many they have treated, what was the outcome, did they have any problem? I have not seen any data. So I can't really answer how successful they are. But it should be encouraged, because we cannot claim that modern medicine can do everything. There are things which we cannot do. If somebody else can do it effectively, a good job, why not? But they should produce evidence. Yeah.
Right, sir. Thank you. So next question. Can you please share your opinion about the reliability of the current research publications? We see that there is a gross change in all aspects of research, including ethical guidelines. Can you please share your opinion about the reliability of the current research publications?
Research publication, it's a complete mess today. Because UGC guidelines are there. There is great pressure from the universities, colleges, and so on for publications, for their promotion. So that in order to fulfill those requirements, people do research and publish papers. There is tremendous increase in plagiarism, for example. So the journals, predatory journals are there. So it has become a big job today to assess whether this particular journal, simply publishing a journal doesn't mean anything. But you have to have a separate office today in big institutions like Manipal we have. They do research. There are search engines to do this, whether about plagiarism, whether this journal does it in a predatory category. All these have to be assessed because the number of journals are phenomenal. And you have no idea how good they are. So that is the problem today we are facing, because the requirements that you have to publish, that leads to publications. Most of them are worthless. So there is, I'm not very sure how this can be controlled. I know efforts are being made by academies and so on. But predatory journals, it is shut down in one place and they start with another name in another place. So we have a complete mess in that area, I think. But it needs to be, I'm not very sure this publication as a requirement, that has led to a spurt in the number of these journals being published. But any major institutions and all that, there is no problem. They only take the standard journals, including Indian journals. Their publication only they will count. All the others, they won't even look at it. But that will not be due for when we have so many medical colleges, so many 900 universities. So you cannot limit it to this. So we have a problem, how to solve this. So many journals are started. Because we don't do that much of research in India to have so many papers. Because if you want to publish a research paper, case reports are excluded. Otherwise, you have to do at least a year or two to do a project before you can write a paper. So when one particular person is producing so many papers, that itself becomes suspect. So something needs to be done, but I'm not very sure how successful we'll be because there are so many, the numbers are so large. Medical colleges, I think we have 600 medical colleges. If each one is going to start a journal, Where is it going to end? That much of research is not being done.
Yes.
Sir, thank you. Thank you very much for your valuable time, sir. Sir, we are really honored to have you on this World Health Day, and we wish you a happy and meaningful World Health Day, sir. And
Thank you.
I would now like to hand over to Dr. Sarita RL, the Director of Health Services, Government of Kerala, to deliver the vote of thanks.
Thank you, Mariam. Respected Vibhushan Dr. M.S. Vallithan, sir. Dr. Rajan N. Ghobrade, our Principal Secretary, Health. Dear colleagues and students. Building a fairer and healthier world for everyone. That is the message WHO put forth on this World Health Day 2021. Yes, we heard from a great person how it could be made a reality. Vallithan, sir, please accept our sincere highest gratitude and honor for being with us and interacting with Team Health Kerala on this auspicious World Health Day 2021. At these difficult times and times of COVID-19 pandemic and pandemic fatigue, sir, your talk really made us optimistic and relieved the stress. As you taught us how medical science advanced, how public health and medical education progressed amidst all the constraints in the past. A big thanks to Dr. Rajan N. Ghobrade, our Principal Secretary Health, for inviting Dr. M.S. Vallithan, sir, and also arranging this memorable and wonderful, unique World Health Day observance of 2021, sir. And our sincere thanks to all the participants of KISS for Excellence. Thank you.
Thank you.
Thank you, sir.
Thank you.
It's an honor, sir. Thank you very much.
Thank you, everyone. With this, we come to the end of the forenoon session. We can meet again on Zoom at 1 p.m. for the afternoon programs. Actually, two very interesting programs have been planned. One is the Agents of Change, which is presentation by the foot soldiers on their success stories, and a brainwave challenge, which, as I understand, is a platform for young researchers, including field officers, students, and faculty members, to showcase their work on developing simple, locally adaptive, and feasible solutions for a positive change in health. And the links for the afternoon session are different from this one and has been shared in various groups a priori. So please do join us in the afternoon. On behalf of the organizing team of Quest for Excellence, I once again thank our chief guest, Padma Vibhushan Dr. M.S. Vallithan, sir, our Principal Secretary of Health and Family Welfare, Dr. Rajan, sir, our DME madam, DHS madam, principals from all medical, nursing, and dental colleges, officers from the health services, medical teachers, and above all our students for making today's program a grand success. So looking forward to seeing you all in the afternoon. Keep up the spirit of World Health Day. Thank you.
Thank you.
Thank you, sir.